Hi, I'm here in London today to see the NHS, specifically East London Foundation Trust. They're revolutionising the mental health services they deliver to service users and carers using VMware. So let's go and see how they're doing that.
I'll take you around to our QI area. So at ELFT, we have a real focus on quality improvement. This is a representation of our focus on QI. You can see that we've got diagrams, some of the steps we go through, the projects we've got active. This is something that's really at the core of what we do.
Should we have a little chat about how you're using IT to transform that?
Absolutely.
What does innovation mean to you and to the Trust?
It's key that we have a solid, robust platform to deliver some of these innovative solutions that can improve service user care, such as patient accessing and managing their own record. All my work in life has been pretty much in the digital field. I've always felt that the right technology in the right place can really make an impact. Now, taking that into healthcare, if we get the right digital solutions, that can really help make a difference in how that care is delivered.
Sometimes there's a big gap between the technology and the point of care or that point of service. How is sort of VMware Cloud on AWS and the work we've been doing improving care?
Considering the period we've just been through, technology has really enabled us to deliver services in different ways. We're starting to see where there's been improvements where digital platforms were introduced to deal with the pandemic. The way that the team from VMware supported us when looking at different cloud platforms, different options, attending calls with us where needed, even face-to-face meetings if required. Really going that extra mile to make sure we progress to that platform.
So, how has technology impacted the experience you deliver to the service users?
From a digital perspective, we need to ensure we have a strong foundation from which to work from. The platforms that we look after and support at the Trust have a direct impact on patient and service user care. So it's really important that those foundations are really strong. We're making the correct strategic decisions with where the Trust is headed, not just in the short to medium term, but over a 5-year period. During the pandemic, the world changed for us overnight in terms of the way our service users receive care. We found there were a huge number of people who were excluded because they didn't have the likes of laptops and mobile phones. So we enabled digital pods, a piece of software overlaid on top of traditional computing, and users could come into one of our pod areas and receive care from clinicians. Good effective technology means that clinical staff engage more with service users than previously.
Thanks very much for spending time with us today. It's been very interesting to learn about how technology is really making a difference to the service users and carers here at the Trust.